Everyone. Welcome to the fourth and last community forum for the ATI project. Just to mention this, the session will be conducted in English, but we will have simultaneous interpretation to Spanish. I'll ask Carlos, our interpreter, to explain how interpretation is going to work. Carlos, happy to see you.
Happy to see you. Good morning. As Octavio just mentioned, we will have simultaneous interpretation into Spanish. I will now begin with those instructions in Spanish, and I'll be back with instructions in English just in case there are any comments in Spanish. Muy buenos días. Como se acaba de indicar, se está ofreciendo servicio de interpretación simultánea para esta reunión. Para aprovechar el servicio solo es necesario desplazarse a la barra de controles de Zoom, por lo general en la parte inferior de la pantalla. Ahí verá un icono de interpretación, parece un globo terráqueo, y seleccionaría Spanish o español. Si está utilizando la aplicación móvil de Zoom, es decir, en celular, tablet, etc., presionaría primero más, los puntos suspensivos, luego interpretación y luego el idioma. Por último, si no desea escuchar el audio original en inglés en el fondo, por favor seleccione Mute Original Audio o silenciar audio original y por cierto, el icono aparecerá justo después del aviso en inglés. Good morning. Again, simultaneous interpretation is being provided. In the event that there are any comments in Spanish, if you want to take advantage of the feature, all you need to do is after this announcement, scroll down to the bottom of the Zoom screen where your meeting controls are. There you would find an interpretation icon, looks like a little world, and you would select English as your language. If you are joining through the Zoom mobile app, however, you would first press More, the three dots, then Interpretation, and then choose your language. Finally, you would click on Mute Original Audio if you do not wish to hear the original Spanish low in the background. Gracias and thank you, Octavio.
Thank you very much, Carlos. Well, again, welcome to the fourth and last ATI Community Forum. I am Octavio Rodriguez, and I'm the new Criminal Justice Principal Researcher here at SANDAG. As part of the Alternatives to Incarceration, or ATI project, SANDAG wants to have the opinions and thoughts of San Diego County residents on the county's justice system, public safety, and provision on behavioral health services. And that's why we are having this community forums. The way the forum is going to work, we will start with a 15-minute overview of the ATI project, conducted by Dr. Cindy Burke, the Senior Director of Data Science here at SANDAG. And then we will allow for 90 minutes for public comment. As we've done in the past, we welcome everyone for being here. And we thank you for insights that you can provide that are going to be very valuable for our project. As you can see, your cameras and microphones will be muted. But if you want to comment, please raise the hand on your Zoom reactions, and we will unmute your microphone so you can comment. If you feel comfortable, we would love to know who you are, if you belong to any organization, and if you have a specific reason for attending here today. We will thank you for respectfully conducting to each other, and we ask you to abstain from promoting businesses, services, or any other initiatives that do not relate to the topics we're discussing. We will allow for 3 minutes to each speaker to comment and share thoughts with us. We will have a timer showing the amount of time that you have, so you have that guidance, and we allow from the greatest number of individuals to participate. One thing that's important to mention is that while speakers can share any thoughts or feedbacks, SANDAG and the County of San Diego have specific interest in receiving information, feedback, or comments regarding 6 specific questions of interest. We will read these questions again at the end of the 15-minute overview, but I'm going to read it again so you can start preparing your comments and thoughts following this guide. The first question that we are interested in is, what are the greatest gaps in services in your community? Second, what are barriers to receiving services in your community? Third, how can we encourage treatment that is voluntary as opposed to court order? Fourth, What are your greatest public safety concerns in the community and why? Fifth, do you know of any policies or programs that are effective alternatives to incarceration that the county should be aware of? And sixth, what is working well in terms of the public safety system and services delivery you would like to know? Again, at the end of the overview presentation by Dr. Burke, we will repeat these questions again. We now open the floor for Dr. Burke to start with a 15-minute introduction. Cindy, please.
Thank you, Octavio, and thank you everyone for joining us for this, our last of 4 community forums. We'll be having 2 more at the end of the year when we do finish our first comprehensive report on the project. But we wanted to provide a little bit of overview for those of you who may not know as much about this project and what the impetus was for it. It really was driven by the County Board of Supervisors, who saw how public safety numbers really changed during the COVID pandemic. This slide was one that we presented to the Board of Supervisors, and all of our reports and our PowerPoints are on the SANDAG website for this project, sandag.org/ATI study. And you can see that pre-pandemic, looking from January 2018 to February of 2020, there was a monthly average number of bookings of just over 6,600. And when the pandemic started, there was a large drop. And then that monthly average after that was 3,800. But you could see we dropped down as far as below 2,700. So a 42% drop of the number of bookings into jail pre-COVID to during COVID. Why were there so many drops? We did interviews with our stakeholders in the county, and this was also part of our report to try to understand, and we categorized the 7 factors that could account for this. It's really challenging to say that one factor is responsible for a certain percentage of decreases or drops, though, because many of these policies might have been implemented by the county, and then the state issued something that was similar, more lenient, more less lenient. Numbers obviously changed with COVID when we had spikes during the period. So many of these policies could have changed over time, but they were related to, at least in part, court closures, individuals being released early from jail who could be released without compromising public safety, changes in bail numbers and zero bail policies of not requiring people to have post bail to be released, modified booking criteria, including, for example, individuals who were arrested for motor vehicle theft not being booked into jail. There were a number of changes there. Obviously taking into consideration other individual factors related to the cases, changes in probation supervision. The local jails could not transfer individuals to state custody, whether that be mental hospitals or to prisons. And then also for all of our crime numbers for 2020, 2021, and even to some degree going into 2022, there's been reduced opportunity to commit some crimes when people were really under the most rigorous lockdown. We saw increases in non-residential burglaries and decreases in residential burglaries. For example, when people were home, the number of rapes went down when bars weren't open. So that's something to consider, as well as proactive policing, law enforcement trying to reduce their contact with individuals unless public safety was really seriously at risk. So all those factors relate to that decrease that we saw. What we really want to make clear is that what we were tasked to do, the county put out a request for proposals, an RFP. SANDAG and the Criminal Justice Research Division did apply for, respond to that RFP. We were selected through a competitive process, but it was a very specific scope of work. And so we've heard a lot of feedback already from the working group, who I'll describe to you, the advisory committee that we've put together that we'll describe in more detail, as well as the community in these community forums about wanting to look at issues outside the scope of this work. And unfortunately, there was a certain amount of funding and tasks that were aligned for this. So we are interested in that feedback. It is something that we can pass on as a recommendation for future research for the county to explore. But we just wanted to make it really clear that if we are unable to say to you, yes, we're looking at that, it's not because we don't think that anything that anybody brings up in any of these forums is an important thing to look at. It's just that we have a very particular scope of work. And if anybody's ever contracted with the county, I hope they can understand that. But the first research goal is really trying to do a data-driven analysis.
I'm not sure
It's
if
something that's
it's
anecdotal, but
my-
really compiling data pre-COVID to during COVID.
we're losing you, Cindy. Sorry. I think it's your internet connection.
Can you hear me now?
Yes, we can hear you well. And I'm sorry to interrupt.
Okay, no, I'm glad that if there were difficulties, I couldn't see it at my end. So we're doing data, we're trying to look at data, we're trying to understand where could there be a county to potentially look at alternatives to incarceration. Again, looking at those primary policy drivers, conducting a policy sub-analysis, trying to understand who was in our local jail.
We're having technical difficulties again with Cindy's connection. We'll try to see if we can fix it, and we will continue with this presentation. Cindy, if you can hear me.
That was outlined in our contract. Can you hear me?
Yes, we missed pretty much all the explanation from the previous slide. I don't know if you want to return, and maybe if you turn off your video, might be better.
Okay, how's that?
It's working well for now. We
Okay.
were in research goal number 2.
Okay, so research goal number 2. Okay. So we want to look at, understand the populations who were in jail, understanding the length of stay that individuals were there, what were they booked for, also looking at where they came from, looking at public safety outcomes regarding ongoing contact with the justice system. And then again, comes back to making those policy changes and recommendations, how the county could possibly safely and permanently reduce jail populations and better protect public safety. Then the county is interested in looking at short and long-term actions and investments to expand alternatives to incarceration who do not pose a public safety threat. And then finally, analyzing the cost savings and long-term fiscal impacts to public safety departments, health and human services, and other aspects of county operations. We are focused on just what the county has the ability to control, not necessarily other law enforcement jurisdictions. And we are focused on adult populations, not juvenile, for this study. And again, trying to look at how the county could potentially shift from public safety to prioritizing safety through services and evidence-based alternatives to incarceration. So how are we doing all that to answer those research goals that were put forth for us to do? We're analyzing the jail data, and that data has already been presented to the Board of Supervisors, and that presentation is on our website. It is also on YouTube with the county. Understanding who's had contact with the justice system, we compiled data from ARGIS and are also linking that with our data from the county to understand those who could have been booked previously to these changes in policies for low-level offenses such as disorderly conduct or some minor drug offenses. What was their ongoing contact with the system up to a year after that period of time they could have been booked into jail. We are looking at service needs, availability, gaps, and barriers from probation data, as well as from a community survey that we recently finished. We're trying to understand the level of service needs for this population, working with Health and Human Services and the probation department to categorize the types of services that are there, and then understand through these discussions, as well as that analysis, gaps where there may be a need for more services. Or barriers for service, engaging the populations, and also anything else that could negate the fidelity or the usefulness of these programs. We're looking to do a literature review, basically, best practices of looking at proven and promising programs that could be in the county, the state, the country, internationally, that the county may want to consider for implementation or expansion. And then also a cost analysis that looks 1, 5, 10, and 20 years out, that would be able to offer did I just get, okay, sorry, am I still good?
You're still good, Cindy. We can still hear you.
Okay, your pictures all just went away, so I was worried that somehow I got disconnected. So trying to understand the if the county did invest in alternatives to incarceration, what potential cost savings could there be? And then underlying all that data, we really want to make it clear that we're trying to share the data in a timely fashion with stakeholders, again, through the presentations to the Board of Supervisors, through these forums, through our advisory group meetings, to be able to have community engagement and feedback. And all of the comments that are shared with us will be shared directly with the Board of Supervisors. So let's go to the next slide. So our advisory group, I know I saw at least one of our advisory group members who I hope will introduce herself, and anybody else who's on. We had 88 people from the community graciously offer to be on our advisory group and completed an application to be part of that. We had 14 individuals selected from an outside group that was able to spend their time and commitment, which was no small feat, to try to narrow that down to a diverse group of individuals with lived experience, working with the community experience. And these are some of the pictures of the individuals. So we're very grateful for that, their time. We also work with a working group that we just added a list of who those individuals are to our website if you're interested. That includes representatives from the Public Defender's Office, the District Attorney's Office, the Public Safety Group, Health and Human Services, City Attorney, as well as local law enforcement and the Sheriff's Department. I'm hoping that many of you also took the chance to do our community survey. We ended up keeping it open actually for 5 weeks, not just 3 weeks. And we had over 2,000 surveys in both English and Spanish that was submitted. And we're in the process of analyzing that for a report that will be submitted at the end of this month to the County of San Diego. If you are not already on our list to receive emails about when new publications and documents come out, we'll have a slide at the end here for you to write that down. But you can email us or put a comment on our website again at any time to get added to that mailing list. So our next steps for the project are finishing our analysis of the community surveys, holding these community forums. Again, today is our last of 4, compiling that information on best practices and policies, understanding the ongoing system contact for those not booked into jail, documenting our regional service availability and conducting that gap analysis, and doing our cost study. And we currently anticipate that the study will be done in early 2023. So while we hope to have everybody really having a good dialogue today, in past forums, we've had the ability for individuals to speak more than once and to be able to respond to each other's feedback and comments. This slide shows the questions that we really are hoping to get at. So if you do have thoughts or feedback, we'd be very grateful for you to share them with us, because this is really tied directly to what we're supposed to be doing in the scope of the work for the project. Again, understanding what gaps there may be in service needs for the community, if there are barriers to receiving services that you have direct or indirect knowledge of that you'd like to share. Looking at how do we engage people into treatment when it may be voluntary, whether that's for substance abuse, mental health, homelessness, if there's ideas or proven programs that you're aware of. If you'd also like to share any concerns you have about public safety, that is another question we had on the survey and that we wanted to include here. If you know of any policies or program that are effective alternatives to incarceration that we should research further as part of our best practices review. And then we also just wanted to give people an opportunity, if they think something is working well, to be able to give a shout out of that. So we're not only focusing on what isn't working, but also what is working. And again, I'll just leave this up for a second before we start putting the timer slide on, and Octavio can start giving people a chance to share their thoughts. But our website, sandag.org/ATI study. And you can also email us at atistudy@sandag.org.
Thank you very much, Cindy, for the presentation. And as Cindy mentioned, our advisory group has been tremendously helpful in this project. And so we want to thank them and recognize some of them who are here with us today. I see Andrea Dabber-Griffins joining us today. We hope that they can share with the forum their experiences and their visions on these topics. So now we will open the floor to our attendees to share insights for up to 3 minutes. As I mentioned, on the screen, we'll have a timer showing the amount of time that you have, and I will be naming people based on the hand written in the reactions button. So I will start with the ones that already have their hand. I'll start with Jay Byram.
Yes, hi. My name is John Byram. I've worked in the substance abuse field for the past 30 years and have been in recovery for 36 years. So I've been around a long time. And one of the most successful times we had was when Judge Milliken was on the bench. And one thing he did was he concentrated at the beginning rather than when someone's already in trouble. Say they get in trouble for the first time. So we would work with those individuals and they would be put into programs. San Diego County has done alternative sentencing since I've been in the substance abuse field, and we did it very well until the propositions came in and there isn't any kind of consequences for an individual when they break those now. Judge Milliken also worked with families before they got into the system, and it ended up, Judge Milliken saved the county $1 billion. It was a very successful program that we aren't doing anymore. So I'm going to leave it there and let you go on to the next person.
Thank you very much, John. And as Cindy mentioned, you are more than welcome to participate more than one time. So if you already participated and want to come in more, please don't hesitate to do so. Next in line is Tom Packard. Tom.
Yeah, can you hear me?
We can hear you well, Tom.
Yeah, my name is Tom Packard. I'm a member of Showing Up for Racial Justice, North County, and I'm a professor emeritus in social work at SDSU. Perhaps the most significant gap in services that I see is the inadequate availability of immediate and ongoing evidence-based services following 911, Access Crisis Line, Mobile Crisis Response Teams, Psychiatric Emergency Response Teams, and/or the Crisis Stabilization Unit contacts. The promise of countywide MCRTs will not be fulfilled unless behavioral health services ensures that such services staffed by well-qualified and well-paid professionals are available immediately and for as long as a client needs them. An information system that links law enforcement and behavioral health data will be essential to properly track vulnerable people from an initial contact by law enforcement to an ultimate outcome, which includes stable permanent housing after necessary services have been fully delivered. County behavioral health services should ensure that adequate funding is available for ongoing service provision. For cases that do end up at jail intake, thorough assessments by licensed clinicians should be done to potentially avoid incarceration through referrals and to ensure easily available clinical services for all incarcerated individuals. The excessive number of jail deaths in San Diego County jails is partly a result of improper treatment of inmates with behavioral health issues. Millions of dollars have been spent on lawsuit settlements regarding shamefully inadequate treatment of inmates. the county's Citizens Law Enforcement Review Board should have increased powers for oversight of sworn and civilian staff of the jails to identify system level problems and ensure that they are adequately addressed. Thanks for your attention.
Thank you very much, Tom. I don't see any hands as of now. I encourage everyone in the forum to share their thoughts, experiences, any concerns that they might have. Again, this is a place for community members to share their views and thoughts, and anything that we can say in this forums will help tremendously our research. Is there anyone that wants to participate? Please raise your hand. Otherwise, I might ask Andrea Delbert-Griffin if she wants to share some thoughts on the ATI project and these topics. Sorry for putting you on the spot, Andrea, but please.
That's fine. I get put on the spot a lot. So thank you to everybody who's attending today. As somebody who has worked in the reentry community for over 7 years and has worked collaboratively with a lot of community providers to transition individuals effectively and safely out of jail, I think that this conversation that we're having here, along with all the other community forums that have been held, are tremendously important. And our county leadership has decided they want to take this up as a topic to talk about and find solutions for. And you know, what I can say is that transitioning individuals out of jail is a remarkably complex process, as well as, you know, when people come into jail, it is also a remarkably complex process. And so I think we've all collectively identified some of the issues. You know, in jail deaths were just mentioned by Tom, and that's obviously a huge issue. But there are many other issues that we face in this complex sort of public project that we have going on here. One of the things I often think about is how can we effectively and safely keep individuals out of jail that really don't need to be there, while also contributing to our community's collective feeling of being safe and staying safe. Because although certain crime categories have decreased throughout the pandemic, other crimes have gone up. And I think, you know, when you kind of read into social media, or you have just general conversations with your neighbors and community members, you also get the sense that there is a sort of enhanced sense of feeling unsafe in our streets. And so this is a very kind of complex project that is being pursued here. And hopefully at the end of it, we will all come to a better understanding of how we can both effectively work with individuals who are justice involved to keep them out of the justice system, make sure they get the help and the support they need, while also hopefully enhancing the general public's perception of their communities being a safe place for everybody.
Thank you very much, Andrea. And yeah, this is very, very important to have in mind. I have Tom Packard next. Tom, please.
Yeah, I got a text message from one of my colleagues with Showing Up for Racial Justice, Robin Sales, and she says, I think she's in her, maybe in her phone, and she has a phone number, but she can't raise her hand. I have her phone number. Is there a way that you can get her connected so she can make a comment?
Hi, Tom. We see one phone number here listed. I'm going to ask my team if we can allow that participants to speak. I think they should be able to speak right now.
Hi, yes, this is Robin Sales. I'm with Showing Up for Racial Justice North County and the Racial Justice Coalition of San Diego. I'm also representing myself, but I'm on the Behavioral Health Advisory Board from District 3. I want to echo what Mr. Packard and Dr. Griffin just said. We are really interested in the MCRT, the Mobile Crisis Response Team, working effectively to prevent incarceration. Our groups have been following the MCRT now since before the pilot began in North County in January of 2020. We're heartened by the fact that there is an MCRT, but concerned that there are not enough resources being devoted to care for people after they're hospitalized or after they go to a crisis stabilization unit. We're concerned that the staffing at those treatment programs, and they're all county contracts, are paid enough to live in San Diego, have a living wage, to retain them after they're trained, and to provide the kind of service that obviously is going to be difficult for people who have lived experiences as peer support specialists dealing with trauma on an everyday basis. So I'm hoping that the ATI will really help strengthen or make recommendations to strengthen the MCRT. And anybody who's interested in seeing a presentation today at 2:30 at the Behavioral Health Advisory Board, there is going to be a presentation on the MCRT, including a dispatch trainer who's going to talk about the criteria and the decision trees that they use to determine whether a call goes to PERT or goes to MCRT or goes to the police. So I encourage anybody who's really interested in taking a deep dive to join in. Just go to the BHAB website to get the Zoom information. And thank you very much.
Thank you very much, Robin. I see Andrea next in line. Andrea.
Yeah, thank you. And thank you, Robin, for these remarks. And I completely agree with you. One thing that I would like to point out is that a lot of the county contracts, since you mentioned county contracts, Robin, a lot of the county contracts have very specified timeframes to them. So for example, a client may receive, I don't know, 3, 4, 5 months worth of services after exiting jail. And the idea, of course, in our county and the system of care is that warm handoffs are being provided to other service providers to ensure that clients don't fall under the radar or drop out of services. And so there are 2 issues with that. Number one, the warm handoff system simply does not work as well as we want it to. And that's because of many reasons that I'm not going to elaborate here. But the other part is, for example, probation has a new service for housing and resource navigation, and that contract limits services to 3 months of intensive case management services plus 2 months worth of so-called aftercare services. And basically the expectation is that probationers are ready to stand on their own 2 feet after receiving, 3, 4, 5 months worth of service. When we know, and we know this from data as well as from providers who have worked with this population for a long time, that sometimes life histories and experiences are so complex and need to be tackled from many different angles, and sometimes it's very difficult to accomplish all the goals that are put forward in a case management plan or in a treatment plan within that specified time frame. And so that is definitely a concern of mine, because we expend taxpayer dollars into programs that are time limited, which they need to be for obvious reasons. But we don't really know much about sort of what the follow-up is after that time in the program has expired. What happens to that individual? Are they able to get back on their feet? Do they manage to get a stable transition into independent lives? Or what happens after that? And I think that is definitely a data gap that we need to have a better understanding of.
Thank you very much, Andrea. I don't see anyone next to, I actually see Tom.
Yeah, I didn't want to overdo my access here, so let me know if, and I know I have my 3 minutes, but just to kind of amplify, I liked what Andrea was saying. I don't know what the probation requests for proposals say, but I know in behavioral health, they talk a lot about using evidence-based practices. And I think there really needs to be clarity on if an evidence-based practice suggests that somebody needs to get seen for a longer amount of time, that ought to get addressed. And just to reinforce what Robin said about turnover in behavioral health contract agencies, that really does need to get addressed, so that the people that get referred out of law enforcement systems do get adequate services. But as long as I have a little time, I wanted to kind of amplify a little bit what I said about the data systems, because I really appreciate Sandag's expertise for over the decades on use of data, and especially in law enforcement areas. And I think Luke Bergman in behavioral health is talking about getting the law enforcement data systems linked with the behavioral health data system, so that you can look at a law enforcement contact when an officer goes to somebody's house. And even before that, Robin talked about the 911 operators being trained to look at the data there and then link what happens to a client there with what happens in the behavioral health system. I know that in the MCRTs, they have a term stabilized in the field. And I think that means that they just stay at their house or something. And I don't know if the MCRT contracts allow the MCRT staff to really follow up with those that are stabilized in their houses. So I guess my overall point is that there needs to be a really comprehensive data system with the original law enforcement data, the contacts by the MCRT, the crisis stabilization units, and then from a community point of view, I'd like to see the service provision data, anonymous, of course, that can be provided about where do these all the clients go, what services are they getting, and then what are they do have through a contract they have with Kazarek at UCSD. They're looking at some outcomes, but I really just anything you all can do to encourage county behavioral health and the law enforcement agencies to get their law enforcement systems linked and be able to use comprehensive data for analysis and program evaluation. I think that would really help a lot. Thanks.
Thank you very much, Tom. And again, do not hesitate to raise your hand if you want to participate one more. This is actually a forum completely open to the public, and we hope to get from these conversations as many information or insights that we can, so we can inform our data analysis. I don't see anyone's hand right now. I encourage you to please share comments, thoughts, experiences, anything that could help shed some light on these topics, on these issues. Again, this is going to be extremely helpful for research. If you have already shared your thoughts, you're welcome to do it once more. But please, for those of you who are attending and who have not participated, we want to hear your voices. So please do not hesitate to raise your hands. I have Dominique Lucio next in line.
Hi, my name is Dominique. I'm a housing navigator with the Public Defender's Office, and our unit specifically is working with individuals transitioning out of custody that have a severe mental illness, substance use disorder, or at risk of homelessness, or a combination of all of those things. And we've had a lot of success with our program in directly connecting people to mental health services that are that higher level of need, like ACT programs. But what we see kind of a disparity is the lower level mental health need and housing. So a lot of issues as a housing navigator that I face is trying to connect clients directly to housing vouchers or programs. And a lot of times we see that they're ineligible because of being in custody. There's the 90-day HUD rule that if they're in an institution, they are considered housed, so they become ineligible for things. So that's one of the main issues that we kind of see is not a lot of the community resources are available to our clients. And we see clients obviously be a lot more successful when they are housed, when they are getting the treatments that they need, and not coming back to jail as much if they have all those things in place. Thanks.
Thank you, Dominique. Thank you for sharing. I don't see anyone who wants to participate. We still have pretty much an hour of this forum, so let's try to make use of this time to share views, insights, and thoughts on this project. I will now give the voice to Andrea.
Yeah, thank you, Octavio. Actually, I have a question that is more for you and your team and Dr. Burke. So as we're looking at, obviously the jail population dropped throughout the pandemic. We're trying to get a better understanding of how certain policies enabled that outcome paired with crime data and how it all developed. But I wonder, to what extent are you factoring, and Dr. Burke said it earlier, the circumstance that crime dropped because of lockdowns and people simply not being out in public as much. How are you in your data analysis able to separate that factor, if you will, to come to a better understanding of how policies can be changed to lead to better outcomes as far as the jail population is concerned?
That's a great question. The original design, and we did actually a scope change with the county. They wanted us, and you may remember this from one of our early advisory group meetings, Andrea, where they wanted us to look at 5 different populations. And that included pretrial defendants, community collaborative courts, but doing that pre-post. And it was going to get really messy because there are individuals who may have repeated contacts. So they would have been in both a pre-group and a post-group. So we have that assumption of independence in terms of variability for anybody who's a statistics geek on here. We had that as the issue. And then also the fact that, and this is affected, we worked with you on the STAR evaluation. And for those of you who know the Prop 47 evaluation, when we have a historical comparison group, there's a confound of just, in the ideal world, we randomly assigned everybody to conditions and then we can see what happens to them. And so when you have such changes historically, it's very challenging. What we're going to be doing for that deeper dive is looking at 200 to 300 individuals. We're going to be sampling just on the penal codes that were agreed upon that there could be more discretion on, like with the disorderly contact or the lower level crimes, see if they weren't booked into jail. And then instead of trying to have some fake weird comparison group, we're going to be looking back, what was their contact with the system the year before, by able to look at field interviews with law enforcement, citations, arrest, and then look at what happened in the year ahead. So we're not trying to do anything of a comparison that says that there's more or less, but trying to understand maybe what's the length of time between those interactions. Are they always for the same type of types of offenses? Are they all with the same law enforcement agencies? So hopefully we can really have a smaller, richer data set for discussion with your advisory group, the advisory group, as well as to put forth to the county. So that's the strategy we're taking, because we can't really do any kind of comparison over time.
Thank you, Cindy. Andrea?
Yeah, I don't know. Am I still unmuted? I don't know.
No, you are.
Okay.
We can hear you.
Okay. Sorry about that. Thank you for explaining that, Dr. Burke. And I just, for those of for everybody who's on the call who is not familiar with the STAR program, it was a program where the Neighborhood House Association worked very closely with probation officers and clients from those officers to link them to all the needed services that includes treatment, be it mental health, substance use, physical health care, document needs, such as California ID, housing, et cetera. So what we found, and I believe this was one of the outcomes, Dr. Burke, is that the recidivism rate for that group in comparison to the comparison group was not actually lower. And I think we concluded it was in part because we did not specifically address the criminogenic risks and needs factors for this particular group of probationers. And so the county years ago had they called it the Justice Involved Training series, Academy series that many county providers went through. And it really talked about how can we effectively tailor behavioral health services to individuals that have criminogenic risks and needs, particularly as it pertains to their cognition, their belief system. And so, you know, I see this kind of as a nexus, because when we hire individuals that come with their master degrees in social work, in marriage and family therapy, we hire them into our agencies and we ask them to work with our population. They get no training or education whatsoever on how to tailor behavioral evidence-based practices was mentioned earlier, or how to tailor and not just evidence-based practices, but also mental health interventions to this particular population. And so I think that is also a gap in our county.
Thank you.
Thank you, Andrea, and thank you, Cindy, again. For those of you who joined recently, we'll remind you that this is a forum that's open to the public. If you want to participate, you can use your reactions button and raise your hand. Again, this is a place for the community to share thoughts and insights that will be extremely helpful for our ATI project. I also want to acknowledge Bill Payne from the
Hello,
who's also here, and our members of San Diego County, some partners of San Diego County who have been extremely helpful in this project. So if any of you have any thoughts or comments that you would like to share right now, we would be extremely thankful for that. I don't see any hands right now, so just going to remind you that please help us to gather as much context to accompany the data that we're going to analyze. That is why we've had the community surveys, and that's why we have in this community forums here, so we can give as many details as I mentioned, context to the data that we will present. Again, for those of you who recently joined just joined and didn't hear the beginning of our presentation, we welcome comments on general aspects of the criminal justice system and public safety. But in particular, we're interested in six specific questions that will help lead our study. I'm going to repeat those questions just for the benefit of those who just joined, or for those of you who already heard them, just to remember those specific questions. Question number one is, what are the greatest gaps in services in your community? Question number 2 is, what are barriers to receiving services in your community? 3, how can we encourage treatment that is voluntary as opposed to court order? 4, what are your greatest public safety concerns in the community and why? 5, do you know of any policies or programs that are effective alternatives to incarceration that the county should be aware of? 6, what is working well in terms of public safety system and services delivery you would like to know? Again, those are the 6 specific questions that Sandag and San Diego County is interested in having insights on. So if you would like to share anything regarding these 6 questions or any other general topic on public safety and criminal justice, we welcome your participation. Again, I remind you, if you want to participate, just raise your hand using the reaction button at the bottom of your screen. Right now, I don't see any other hand. Nobody wants to participate next. So maybe I'll ask one of our advisory group members or any of our San Diego County partners if they can share some insights so we can continue the conversation. Well, I don't see any hands right now. We still have about 40 minutes for this forum. We might conclude it earlier if there are no more members of the community who want to participate, but we hope that we can continue this conversation much longer. And I see Laura Soto who's interested in participating. Thank you very much, Laura.
Hello, can you hear me?
Yes, we can hear you well, Laura. Thank you very much for participating.
Hi, so I'm Laura Soto, one of the directors at SAY San Diego. I oversee the adult justice programs. I have the cognitive behavioral therapy program with probation, and most recently the community justice initiative with the DA's office. So I'm just going to go ahead and go through these questions, if that's okay. I know this is probably your 4th meeting or so, and you might have heard some of this before, but I'll just go ahead and reiterate some things. So what are the greatest gaps? So, you know, there are tons of programs for juveniles, which is great and incredible. But yes, as everyone has probably mentioned, definitely need more adult prevention and reentry services. Of course, barriers that most of us have already seen and been aware of, you know, lack of engagement, well, housing, right, resource, food, transportation, and now inflation and employment. Could be great if county contracts could maybe amend sometimes and pivot to meet the needs of clients, because sometimes the contracts go years and years in length, and so times change. And so it would be great to kind of pivot with some of these contracts to meet the needs of clients faster. How can we encourage treatment that's voluntary? So I actually do have classes with my clients and ask them this question. So they don't mind coming to the classes, but they would like something else added that would make things interesting. So, you know, I have a fatherhood program as well. So the length of my CBT program is 6 months. So maybe, you know, 3 months of CBT combined with another, you know, program that was attractive, like parenting. I know that a lot of our reentry folks, you know, like to get reconnected or need to get reconnected with their children, you know, and keep their families close. And so maybe a model that could incorporate, you know, a combination of programming. And also what seems to work is also, you know, people with lived experience that can speak to the heart of what they have learned through programming. I found has been really helpful for people getting connected with programs and asking questions. Well, where can I get this help? You know, how can I learn something, you know, and make myself, you know, more self-aware of these things, reducing my risk thoughts and my risk feelings and behaviors. So for number 4, There might be some community members frustrated with Prop 47 because they feel that people can commit crimes and maybe not have any consequences. And maybe property crimes have gone up in terms of car break-ins in some communities, which could lead to quality of life issues for residents. And then what's been heard of lately is, the less officers doesn't help the community. Maybe they're feeling like they aren't getting the attention they need to deter crime. So for questions 5 and 6, I will just leave it at that. So thank you for your time.
Thank you, Laura. And again, if we can give you more time if you want to comment on questions 5 and 6. It's really not a problem. Just if you want to, if you're interested in providing more thoughts on that, let us know. Otherwise, I'll ask Andrea to participate next.
Thanks, Octavio. I was inspired by Laura's comments and wanted to ask if SANDAG has ever, or perhaps for this project, will conduct a content analysis of social media posts related to public safety, because I think what we're kind of seeing is this really big disconnect between, again, sort of the general public's perception of crime in their neighborhoods, the actual crime numbers, because San Diego County continues to be, especially as far as violent crime is concerned, like homicides, et cetera, continues to be kind of on the low end, right, as far as that is concerned. But then also sort of the services that are being offered to youth and adults who are going through the process of re-entering society. I think there's kind of a disconnect between these various areas. And I was wondering if you guys have ever done or are contemplating doing a content analysis of like social media posts to kind of understand or get a better understanding of kind of where the public is coming from, how exactly they view these issues, which are, for those of us who work in this field, we know it's very complicated and very multifactorial, but not everybody obviously works in this field.
Thank you so much for that that question, Andrea. At SANDAG, we do a lot of data mining and data science and looking at big data. So we do have the ability to do that. We've run up on some issues with some of the data that's just out there publicly, like looking at housing data, that it actually, there's limits on how one can use it. But I think, when we think about what we all see on Twitter or, nextdoor.com and stuff, I think that would be interesting. When we did the community survey, which is kind of trying to get at that, we did ask about people's perception about crime going up or down and their concerns. It's obviously not a random sample of San Diego residents. And I think that probably when you think about people on social media, it would be a nice compliment. It's outside the scope of this project, though. So I think it's definitely something for us to consider when we put together, recommendations for future phases of this research or other research, or for any of us even to think about partnering to try to figure out how to get the resources to be able to do that. I think it would be interesting.
Thank you very much, Andrea. Thank you very much, Cindy. We still have a little more than half an hour. So if you're interested in participating, please let us know. I have Tom Packard next. Tom.
Yeah, again, since there's time, actually, I had some thoughts on
Hi, Tom. I think we lost your audio.
Yeah, can you hear me now?
Yeah, we can hear you now.
Yeah, this is something I planned to include in my comments. I didn't think I'd have time, but the question about voluntary services, I think, I know the state's trying to address that with the CARE Act court program thing, and I know there are challenges related to 5150 and voluntary hospitalization and things. But I think part of something that would maybe make people more inclined to take the services if there are appropriate and adequate services available. I know just some people working in homeless services and I think they do really good outreach, but I still think that more attention needs to be paid to really having the stable, affordable, and eventually permanent housing available. I think that's kind of a barrier to people getting services because they don't see a viable option. And I think that's mainly a policy issue. I think the service providers, from what I can see from the outside, are working hard at doing that outreach and building the relationship. So I think just, again, I'm encouraging the county to allow more behavioral health services funding so that there can be comprehensive services for people with serious mental illnesses that are refusing services for reasons that maybe could be addressed. And then I had a final thought on barriers. I think the fact that our sheriff is an elected official and isn't really accountable to the county, the board of supervisors, or others in any way has effects on the provision of behavioral health services in the jail. I know that the Citizens Law Enforcement Review Board's working on that. We've been talking to them, but I think just doing whatever is possible to get the sheriff to really increase the amount and availability of behavioral health services to people, both to have the assessments done at intake, so maybe they don't even need to get admitted if they can get good referrals to the outside, or to make sure they do get behavioral health services. And again, there'll be a cost saving probably in preventing future lawsuits related to jail deaths.
Thank you. Thank you very much, Tom. Just as a reminder, if you want to participate, you can click the reactions button and raise your hand. And we will unmute your microphone so you can share your thoughts. We still have a little more than half an hour. I don't see anyone raising their hand, so I will just encourage you to participate. If you've done so, you can still doing it. It's going to be super helpful, and if you haven't participated, please do so. I have next Robin Sales. Robin.
Hi, can you hear me?
Yes, we can hear you well, Robin. Thank you.
Okay, thank you. I was wondering, I know in some of your data that I've read so far, you've been looking at the statistics and the demographics. And one of the concerns I have is obviously the inequity in who is incarcerated. And the racial justice issue really is one that needs to be addressed in our county, and I'm sure all over the United States. I'm positive of that. But when you have, the racial justice issue has to do with homelessness, unaffordability of housing, preponderance of Black people and brown people who are homeless in San Diego. And I am hoping that that is evaluated along with bias in policing. So I understood from what you said at the beginning of the meeting that you have an advisory board of law enforcement. And this is something that has to be addressed to prevent incarceration and prevent in custody deaths, which we know is off the charts in San Diego County by 4 different studies that were done in the last year. And I'm most familiar with the Sheriff's Department's reaction and response to these reports in terms of disparities in stopping people for traffic violations and other stops that are not propagated against white people. So I don't think that San Diego County can move forward until the law enforcement organizations and agencies are willing to take a deep dive, willing and able, because they have not been up until now. Look what's going on with the CPP process in San Diego City. The clerk makes recommendations to the Sheriff's Department, and they languish, policy recommendations that languish for sometimes a year before there's a response in terms of change in policy. And oftentimes their response is, well, we think our policies work just fine. Well, I think we all know that their policies don't work because people are being arrested and people are being incarcerated. And unfortunately, some people end up losing their lives while in custody. So I hope that that is something that you all plan to really do a deep dive and talk to that law enforcement advisory board about. Is what can they do to change their policies? I know the Protect ordinance has been trying. There are many groups in San Diego County and City who have been trying to get that passed, and they've met with tremendous resistance. So I just wanted to add that, and thanks for taking my call.
Thank you very much, Rowan, for raising this very important issues. Racial justice and bias in policing is out of the scope of our research, of our project. However, we will make sure to include this as an issue where community wants to have much more research on. So we will certainly make sure that we can advise, or we can suggest this as a future topic of further research. I will now give Andrea the opportunity to comment.
Yes, thank you. And if I talk too much, just, don't call on me. But Robin just made some really excellent points, and I just wanted to expand on that a little bit. In as far as policing is concerned, there has been this notion. So we're talking a lot about evidence-based practices and treatment and services. And so as far as law enforcement is concerned, and I know this is out of the scope of this program, but in the end, or of this project, but in the end, when you formulate your recommendations, perhaps this is something that can be included. As far as law enforcement is concerned, there's also the notion of evidence-based policing. And I really would love to know whether this is on the radar of our law enforcement agencies, evidence-based policing. So for example, NACOL, which is the National Association of, oh geez, it's a long name. Basically, it's the professional association that enables civic oversight boards throughout the country to become educated on the latest developments in civic oversight of law enforcement. And so NACOL has their conference coming up, their annual conference, and they have a keynote speaker who talks about how body-worn camera footage can be analyzed from a research perspective to identify evidence-based practices to improve policing, not just for the community, but also for the officers. And so I'm just wondering if this is something that is on the radar of our law enforcement agencies. If not, is it something that can be put on their radars? Is there even research that looks into this, in San Diego County? And so I just kind of wanted to throw that out there as well.
I was just looking at our attendee list, and I don't see anybody specifically from any of our law enforcement agencies who could speak to that. From working in this field since 1992, and I think there are a lot of people on the call who've been in San Diego for a long time as well. I remember when we had problem-oriented policing and community-based policing, and obviously as technology and everything else has evolved and changed, it's a much more complex world. And I think that this would definitely be something for I don't want to speak for law enforcement, and they're, again, where they are, I'm sure, we have 11 different local law enforcement agencies in San Diego County. My experience personally has been they're very open to trying to institute best practices where possible. But again, Andrea, this is one of those things I think that we would put in there as an area for future research and discussion. And then just with our public safety committee meeting too, I think that might be an interesting kind of thing to explore with them there too. But thank you for that comment.
Thank you both, Andrea and Cindy. I have John Byron next.
There I go. I was asked to comment on two state mandates that were given to our district attorney's office about diversion programs for adult and juveniles. Have Sandag seen these and have they looked into it? And my comments were, and it's probably not going to be real popular here, but there has to be consequences. If an individual doesn't follow through, there needs to be some kind of consequences. And, you know, if back with the drug courts, when an individual didn't follow through, there was flash incarceration, a weekend in jail. And it was one of our most successful programs there. And that has been taken away by Prop 47, and the numbers are way, way down for drug courts in San Diego County and across California. But that's all I have. Thanks.
Hey, it's good to see you on here. It's been a long time since we've chatted, John, so thank you for coming. You know, I think this is one of the challenges, seeing the pendulum swing, and that's why we wanted to have that question about how do you encourage voluntary treatment. When we ask in our interviews in the jail with individuals, would you go to treatment if it was voluntary? And about, I want to say 3 in 5 of the individuals say that they won't. This is my personal opinion right now, and this is not based on data or research. It's just been in the field for a long time. And I can't remember if it's in one of these forums, but if you get me over a big cup of coffee or a glass of wine, I'll be talking to you all night about this. Is where is when you have individuals who have mental health needs, substance use, who aren't at the point to make lifestyle changes, maybe because they do have so many underlying issues. Where is that hammer of incarceration, or where do you get the incentive? And I know when Prop 47 passed, you know, I did some research into it, and it shows that court-ordered treatment can be just as effective as voluntary treatment. And so I think this is the, you know, $1-million question, and everybody who's on this call, looking at the list, we have county stakeholders, we have treatment, individual service providers. And I hesitate to act like I know more than you do when you're out in the trenches every day. And I just look at mostly at numbers nowadays after I've been here, but it's like, where is that right mix of creating opportunities, meeting people so that when they are ready to engage in treatment and be at that stage, you know, the readiness for change, they have the treatment opportunities for them. And so if there are people who'd like to comment on this, but also when they aren't engaging in treatment, when is it appropriate, effective, necessary to have some type of hammer, whatever that hammer is? I hate the word hammer, but you know what I mean? And so I don't know what that answer is. I don't know that there's anything that really shows best practice. I know that one thing from doing all this research for so long is that, you know, it's so complex of understanding what works and what doesn't work. And there's fidelity of programs, and there's engagement in treatment, and it's how do you measure recidivism, and how do you measure success, and what the dissidents, and you know, it's not just black and white. When I go out and talk to community groups, I say, you know, anytime we try to do behavior change, you know, we're halfway through the year, how many people here are trying to make behavior change, and it's challenging to do it, let alone when you don't have all the other underlying issues. So that was a really long answer, and it wasn't really an answer, but I hope it maybe spurs on some more good conversation about it. Is an interesting question, and I don't know where we get that right fit, where somebody could someday say, I'm glad that there was that repercussion that led to the change that I wasn't ready to make myself. So I'm not sure the answer, but I see some hands raised, so I hope that we can have some more discussion around that.
I believe you
Sorry,
gave
I
me
was on
permission to
mute.
unmute.
I was on mute. Yeah, Ron, please go ahead.
Yeah, I think the term today is called contingency-based treatments and therapies, that there are incentives and even rewards for positive behavior as well as for negative. And so contingencies could be sanctions as in drug court or something else, or they could be as simple as a gift card, something like that. I know I managed a program in San Bernardino County, which was CalWorks case management. And we had the ability to benchmark incentives for 30 days, showing up for the first treatment session and completing treatment plans, and then even at graduation. And they were benchmarked and like gift cards for buying clothing for work, provided they graduated and had an offer of employment. So contingency has real merit in the treatment field, especially with things that do not have readily available medicated assisted treatment, like methamphetamine and cocaine and those kind of things. So that's all I got to say about that.
Thank you very much, Ron. I have Angela Law next.
Good afternoon, everybody. Can you hear me?
Yes, we can hear you well, Angela.
Great. So my name is Angie Law. I'm the Chief Deputy City Attorney of the Neighborhood Justice Unit at the San Diego City Attorney's Office. And I guess the only comment that I really want to make is that the difficulty and one of the challenges that we're all facing is the current legislative structure. So, some of the comments that have been made about the successes of drug court and the successes of some of the early intervention type situations are really hindered at this point, not only because of Prop 47, but also because of some of the other legislative changes that have occurred over the course of the last 2 or 3 years. So in addition to pandemic-related impacts on not only the jails, but also the court system, there have been a couple of changes related to misdemeanor offenses that really have kind of tied the hands of not only prosecutors, but just generally criminal justice involved individuals. So changes to the law related to statutorily eligible diversion for almost all misdemeanor offenses. So post Prop 47, that includes everything from simple possession to theft offenses, driving offenses, quality of life offenses, shortening terms of probation as well. So even if we are able to get an individual onto probation, there really is less time for us to not only engage, but also to have a little bit more forced treatment. And I think realistically in the legislative structure, that is something that we are going to contend with until and unless the laws are changed to allow for a little bit more coerced care, I may say, under the auspices of probationary terms and criminal justice involvement. So I think that's definitely something that we will continue to struggle with and something that we will continue to have issues with as long as the law is allowing for many of those diversionary type things that really forces more voluntary involvement and more voluntary access to services than we have previously had in years before. So that's all I have to say. Thank you.
Thank you very much, Angela. And we want to acknowledge Angela, who's partnered with us many times in the past and who's also part of our working group for this project. Andrea, you're next in line.
Yes, thank you. And thank you, Angela, for your comments. I just have this one thought about the court ordered treatment. We work with individuals who are unsentenced as well as sentenced individuals. And so sometimes judges order treatment that is simply not available in the county, and it causes real big issues, not just for the individual that's getting sentenced, but also for the treatment provider or in our case, discharge planning provider that, whose job it is to link these individuals to treatment. And so I do believe that by and large, there's a bit of a disconnect between the courts, specifically judges, and the services that are available in the county. We even see it with public defenders who, call us and say, This client was, sentenced to RTP, which is residential treatment program. And then when we take a closer look at the client, we come to realize that this is really not a good fit. Either it's not a good fit for the client treatment-wise, or this person may have charges or a legal background that makes it simply impossible to get them connected to RTP. So if you're talking about gaps, of course, as far as services, but also gaps as far as communication and collaboration, I do think that we need to strengthen the collaboration between the courts and the involved personnel, as well as the actual treatment providers out in the community. Oh, thank you.
Thank you very much, Andrea. We still have about 10 more minutes. If you want to make just some final remarks, if you haven't participated, you can do so. If you participated before, you can just give us some final thoughts before we conclude this community forum. Again, this is the fourth and last community forum that we're going to have before the report is prepared. We're going to have 2 more community forums at the end of the year, once we have more research, more information about the project. But again, if you want to comment or participate in this last 10 minutes, please do so. If not, we again want to thank you all for being today. For those of you who attended previous community forums, we also want to thank you as well. For those members of the working group and the advisory group, thank you very much for all the help that you have provided. And for county, San Diego County partners, also thank you very much for all the help. Before I bring this to an end, I just want to ask one more time if there is any other person interested in participating. Please raise a hand using the reaction button. Otherwise, we will be concluding this community forum. Okay, so I think this is a good time to bring this to an end. Again, thank you very much for all of you community members who participated. Thank you very much, our working group and advisory group, our community, our county partners, and especially big thanks to Sandak equipment, the Sandak team who made this this community forums possible. Recordings for this and previous community forums are and will be available in our ATI website. So please, if you want to take a look of what other members of the community have shared, you can go there and take a look. Thank you very much also for our interpreter, Carlos. And again, thank you very much, everyone, for being here. On behalf of Sandak, we appreciate your help and your participation.